Can you see my screen? Vasundhara?
Yeah, hi.
Okay, I'm going to do ulta. Can you
Yeah.
oh, okay. I was thinking
Yeah.
last time I could see my previous my next slide. Did you do that, or was that a different platform? I'm wondering.
Yes, I've made it full screen. You can check your chat box.
Yeah, I can see it, and I'll
Yeah.
just see how this works. Okay.
Yeah.
Yeah. And there is no one. Wow. Okay, sorry.
Okay,
This
there
is
is
being
one person.
recorded.
Yeah.
How do you see people signing in?
So I can see who are viewers. It comes on my screen.
Okay.
Okay.
And can people see my face?
Yes.
Okay.
I can obviously show you right now. Yeah.
No, I want to see my presentation.
Cool.
I was just wondering if people can see my presentation and my face. Oh, that's how it looks?
Yeah.
Oh,
Yeah.
okay, fine. Understood. Thanks.
This shows her.
People signing in can introduce themselves. Are you asking me?
Yes.
So we have two viewers.
Yes.
Can they introduce themselves? That one, that one other person ran away. You said there were 25 registrations, no?
Yes.
Usually, I mean, I was expecting at least half of those registrations to come in. Should we have it if we just have one person? It's a very long presentation. It's a lot of work. For one person, it's a bit too much work. I mean, if I know at least who that person is, it would help. Oh, there are 3. Lovely. Vasundhara, I can speak because I can hear you typing. Can't hear you.
Yeah, hi. Can you hear me?
Yeah.
Yeah. There are 3 viewers right now.
Can you see their names?
No, I can't see their names.
I can consider you a viewer too.
Yes.
You haven't learnt about rabies, have you?
Yes, I haven't. Okay, so we have 3 viewers and myself. So there are 4 viewers right now.
Okay. Can the viewers introduce themselves? I would like to know if you're veterinarians, if you are working in shelters, are you rescuers? Just your name and what you do and why you're interested in learning about rabies. Meaning, you can say, hi, I'm Shilpa, I work in CUPA and would like to learn more about rabies. That would do. I just want to understand what my audience is. Do you think they're typing and I can't see, it's not coming across?
No, there are no comments right now.
Okay.
Yeah.
Shall I start anyway?
So we have one comment on Facebook.
Oh,
Dr.
I can
Anil Yadav.
see Anil Yadav. Hi, I'm Dr. Anil working WVS. Lovely.
Yeah.
WVS
Yeah.
Uti, Goa. You would know him if he was in
WVS
Goa,
Ooty.
right,
Yeah.
Vasundhara?
WVS Ooty. Yeah.
Uti, okay. Cool. We have one word, that's good. Okay, anyway, I'll start.
Yeah.
I'll wait for the messages to come in while I present. So, good evening, everyone. I'm Dr. Gowri, and I work for Mission Rabies. I've been doing various kinds of work for Mission Rabies, starting with diagnostics and surveillance. I also work with the government for licensing, and my recent interest has been oral bait vaccines. So any questions on those matter I'm willing to take later, but I will start on the basics of rabies right away. Vasundhara, can I see my presentation? Yeah, thanks.
Yeah.
So in this webinar today, I'll be speaking about what is rabies, the epidemiology about it, a little bit of transmission and pathogenesis. I will speak a little about clinical presentation, both in cats and dogs and other animals, and what to do with a suspected rabid animal, and how you could diagnose it. And to end the webinar, I'll be speaking a little about immunization. And within immunization, I'll be speaking about vaccines for dogs, vaccines for us, human beings, and how you could control rabies. The presentation is not going to be too long. I don't like boring my audience. It will be quick and fast. I'm happy to take questions. So as in when you think that you want to stop me and get something cleared, feel free to comment in the chat box, and I will get back to you soon after the presentation. Okay? So rabies is a very old disease. Human beings understood what rabies was back in 1930. That's around 4,000 years ago. And when I say understand, it was that people understood that if a rabid animal, most probably wolves in that time, if they were to bite a human being, they would die after a while. That's the basic understanding of what rabies was. We know that people back 4,000 years ago understood rabies because there have been a lot of engravings in caves showing like stick figures of people being bitten and dying. Very basic. Also, later by 1566, this is a Latin medical book where rabies has been described. Here you can see a scene where a dog is biting someone and people are beating it to death because they know that it's dangerous and will bite other people. So rabies is very intriguing, a very mysterious disease. It's not like our other diseases like flu, or for that matter even COVID, where you meet someone with the clinical sign, it gets transmitted and you fall sick and you understood where you got it from in general. But what happens in rabies is sometimes you don't know where the contact is from in case of bat rabies, and in case of dog rabies, people who are in touch with dogs regularly, or say a few 100 years ago, dogs were on the streets then too, and you're exposed, and you don't know when you are actually exposed to a rabid dog, because all bites are not rabid bites, right? Also, the mysteriousness of it was that the clinical signs varied a lot. People showed clinical signs that were very aggressive, difficult to understand. Animals showed similarly mysterious mysterious clinical signs. So what popular culture did was have creatively exploited this part of rabies. And back in 1500, the concept of werewolves came into folklore. So here you see an image of a man who on his fours carrying a baby from the house, and he has destroyed everything around the house. So the concept of werewolves was inspired by rabies, and over the years, werewolves have evolved, and we know quite a few popular movies that are based on werewolves. Similarly, vampire bats inspired vampires, vampires and Dracula, with a bit of seduction introduced into the stories. There was all about this biting in the neck or sucking blood, and then this person becomes half dead. So, half dead is something that is very closely associated to rabies. When you look at a rabid animal, it looks blank. The animal or the person doesn't understand what's happening. They're there, but there is exaggerated response to some things, and there's no response to other things. So vampires and Draculas were inspired back in 1897, and for all you Twilight fans, both of these are in one movie, vampires and werewolves, both inspired by rabies. And slowly over the years, there have been a lot of other movies and books. Most popular is by Cujo by Stephen King, and other movies that play around the concept of rabies. And by 1968, the concept of zombies came up, and The Night of the Living Dead is a very popular movie. And it was the first movies to talk about zombies. And zombies are very popular right now. So the thing with rabies is it's 100%. I like to call it a one-way ticket. If I was interacting, I would ask you what mortality is and what case fatality is. So mortality is the number of deaths that happen due to a disease. A case fatality rate is the number of deaths that happen after an infection happens. So in diseases like yellow fever, cholera, dengue, the case fatality rate is very low, meaning if a person starts showing clinical signs of the disease, any intervention brings down the chances of death. So person is hospitalized, they receive rehydration, there's fluid therapy, the person survives. But in case of rabies, once a person starts showing clinical signs, there's no turning back. The person will definitely die. So this gives this bullet-shaped virus a nickname, saying that calling it the bullet that never fails. A little bit of microbiology about the virus. Rabies virus belongs to the family Rhabdoviridae under the genus Lyssavirus. It's a medium-sized virus, very fragile. If you were to leave a sample or if saliva with the rabies virus in the environment, a little bit of sunlight, and if the sample dries up, the virus usually dies. So much for talking about how dangerous it is. Rabies is 100% fatal, yes, but also 100% preventable. There is no treatment, but there is a vaccination. So the trick is to be vaccinated, especially for those who are working in the animal sector. So to reiterate, I did say rabies is 100% fatal, but there have been a few people who survived. There have been 16 reports of people who have survived rabies, but there has been an ambiguous history about vaccination. So some of them might have received 1 or 2 pre-exposure doses, maybe 1 post-exposure dose. The only case where a person has completely recovered from rabies is Gina Geese, and she was the only person to go back to normal life. She did struggle for a few years, but she went back to normal life and is a veterinarian today. But no other survivor has regained all motor skills and do not lead a normal life. Most of them are hospitalized on life support. So the media likes to say that rabies is not 100% fatal anymore. There are survivors, but for better understanding, these are not true survivors. They did not recover from rabies, and they still are struggling from it, but they will also not die because their system is alive, but their motor skills are not there. It's a very sad state to be in. So that's why post-exposure prophylaxis is very important. I will come to that little later. So coming to the epidemiology part, this is a chart showing rabies deaths, human rabies deaths, and Latin America, Africa, and Asia are the 3 continents that have the highest rabies deaths. Latin America very less compared to Asia and Africa. Asia and Africa together report close to 60,000 rabies deaths a year, and 20,000 of them from India alone. This figure here shows dog-mediated human rabies. So these are countries that still have free-roaming dogs and free-roaming dogs that transmit rabies. Oh, sorry, that was this slide. What was this slide? It's been a while since I looked at this. So yeah, sorry. This is the risk of finding a risk of humans contacting rabies, and this could be from any species. But this graph here shows risk of rabies through canines only. So I mentioned that there are other species that people are at risk from. So the reservoir species in different regions are different. Say in the United States, there is raccoon rabies, bat rabies, fox rabies, skunk rabies. Coyote exist is because there are no free roaming dogs, and every owned dog is vaccinated against rabies, so they don't have canine rabies. Similarly, in Europe, eliminated canine rabies in around 1850, and struggled with fox rabies for many decades later, but were able to eliminate fox rabies in the late 1980s. So today, Europe is free of fox rabies also. So in Asia and Africa, canine rabies remains to be the reservoir host. Of course, we have wildlife rabies also, but they are not the reservoir population that is transmitting to the canine population or that is causing deaths in human beings. So for the vets and science students in the group, it is important to know that lyssaviruses are grouped into 3 phylogroups. Phylogroup 1, phylogroup 2, and phylogroup 3, very easy to remember. So phylogroup 1 is where our favorite rabies virus resides. That's the first one on the list, and which is a global problem. The other viruses are very closely related to the rabies lyssavirus, and therefore are in phylogroup 1. Now, phylogroup 2 and phylogroup 3 are a little different from phylogroup 1. I don't want to go into the genetic aspects of this, but for an audience as this sort, the only thing that you should remember is that the vaccines we use to prevent rabies in us protects only phylogroup 1. There is mild protection to phylogroup 2, and there is completely no protection in phylogroup 3. So any exposure to lyssavirus from phylogroup 2 and phylogroup 3 is fatal. We do not have a vaccine for it. So the vaccine won't work pre-exposure or post-exposure. But nothing to worry, these viruses have not been found in dogs. They're only been found in bats. And in India, we don't have these bats carrying these viruses. We don't know. I mean, it's never been reported. So for now, we would think that it's not there. So coming to the transmission. This is my favorite question to ask. If it was a live audience, I would go, what are the methods of transmission of rabies? Of course, all of you know bite, lick. What other transmission methods do you think that could exist? So one would ask if there's an oral fecal transmission. So if someone was to consume, say, brain, like uh, what's the word, beja fry, um, uncooked, that would possibly an exposure if you have any ulcers or cuts in your mouth. Or all of us do have, we all have mild gingivitis, or there are m- brushing injuries, or we might have ulcers. So an exposure, eating anything that could be rabies positive is an exposure. Very rare, it doesn't happen very often, very rare. Another question I usually get is if rabies can be transmitted through milk. No, but the virus has been found in the milk of rabid cows, but the virus was not found to be alive. So there has never been transmission through a milk. Another transmission is that people ask is human to human transmission. So people, there has never, okay, sorry, there has been one report of a human to human transmission. Usually people who, I mean, humans and herbivores and are dead end hosts. The behavior of us and herbivores is not to get aggressive or to bite. But say a cow does get aggressive, but a cow or a bull would headbutt, a goat would headbutt, herbivores would not go and bite. So we become dead end hosts. Similarly, human beings, if a person was to be found rabid, they would be isolated or tied up. So there is hardly any chance of a rabid person giving rabies to another person. There has been one report though, where a 3-year-old baby or a 2-year-old baby who had rabies gave his mother rabies during nursing. So a bite to the nipple when the mother was feeding him transmitted rabies from the child to the mother. That's the only scenario that has been reported. There has been no other report of human to human transmission. Although there is a bizarre rare transmission that has occurred in the world in the 1990s and 2000s, where organ transplantation caused rabies transmission. So while there are a long list of diseases on the panel of disease that you should test before transmission, say one would test for HIV or yellow fever or various other diseases that you would test before donating blood or donating organs, but rabies was not on the list. So this has caused a lot of transmission where a person has died and then rabies people look fine. There are no pathological lesions in the body. So these organs were passed for transplantation. And there are at least 20 to 25 deaths in the world due to organ transplantation. Now you must be thinking, does blood transfusion cause rabies? No, the rabies virus does not reside in our humoral system. It does not travel through our arteries and veins. It can transfer only through the nervous system. So in this image, like I have shown, if a dog was to bite you anywhere on your body, say in this matter your leg, the virus it establishes itself in the nervous system and through the peripheral nervous system enters the brain. So the main aim of the rabies virus is to enter the brain. That's where it can multiply and then transmit downwards back into the salivary gland so that it can transmit to a new host. Now, one thing to remember is rabies, so any virus modifies the behavior of the host so that it can transmit to a new host. There's no point in staying in the same host and the host will die. So what happens in flu, the virus affects the lungs and the upper respiratory tract and it makes the person sneeze and cough and then the virus gets transmitted. Similarly, the rabies virus modifies the behavior of the dog, for usually small carnivores, where the behavior of the animal changes. There is the paralytic form and the furious form. The paralytic form, the chances of transmission are very less, but in the furious form, the animal bites anything that moves and irritates it. So this way, the rabies virus can move to one host, from one host to another. Another question I would get asked is, can a mother transmit rabies from herself to her babies? So again, the answer is no. The rabies virus is in the nervous system, and for those of you who understand what fertilization and gestation is, there is no humoral connection between the mother and child. There is only a humoral connection. There is no neurological connection. So a rabid mother could give birth, if she would last the gestation period, could give birth and will give birth to rabies-free children. Now, a lot of puppies that are born to rabid mothers land up getting rabies because the nursing behavior of a dog is to lick the puppies. So when a mother licks her puppies, she will lick the umbilical cord, the belly button, will lick the puppy's face. So this is the area when the mother transmits rabies to her puppies. Other things about transmission, the virus travels around a millimeter a day, very small amount, sometimes maybe a centimeter. It takes around 3 to 6 months for the virus to travel from, say, your feet or your hands to your brain. The shortest incubation, this is called the incubation period, the time from exposure to the time of seeing clinical signs. Rabies is one of those diseases that has the longest incubation period. But the shortest incubation period in rabies that has been reported is 3 days, where a person was bitten in the face and the virus reached the brain very quickly because it's just from here to here. This is very dangerous because if you were to take a vaccine after a bite and the bite is very close to your brain, there is no time for the vaccine to prevent the disease from occurring. Suppose you were bitten in your hands and legs, there is time for the vaccine to kick in and protect you. Again, that how rabies vaccine protects a person or animal after a bite is still quite mysterious. The theory is that there is a ganglion in near the cervical cord, just close to the brain, or in other parts of the spinal cord, where there is a mix of blood and nervous tissue. So the vaccine is in the blood. Your immune antibodies are in the blood. For the antibodies to protect you from the virus which is in the nervous tissue, this blend has to happen. And for that to happen, there are a few chances for it to happen in your nervous system. So as a veterinarian, as a doctor or a nurse or a rescuer, it is very important for you to understand that a person who's never been vaccinated should get vaccinated immediately. The longer you wait, the higher the chance that you will get rabies. So to prevent this, pre-exposure is the best. So if you're already vaccinated and when an animal bites you, a wound is caused, as soon as a cut or a wound, as soon as the rabies virus enters, your body remembers that it's been vaccinated and immediately sends antibodies to the site of bite. Okay, so this is why there has never been a death in a person who has been pre-exposed, who has taken pre-exposure prophylaxis and has still been bitten by a rabid animal, while there have been deaths in people who have delayed first aid, delayed post-exposure prophylaxis, which includes immunoglobulin. Okay. So coming to diagnosis, back in 1958, Kissling and his friend Gottwasser invented fluorescent antibody test, which is still today the gold standard. Over the years, other gold standard tests have been introduced, like DIRIT and now PCR, especially the RT-PCR with LN34, which is a pan-Lissa virus formula where it can pick up any Lissa virus on the planet. So these are the 3 gold standards that are accepted now. So just so here I've listed gen detection tests, and there are antibody detection tests. So to quickly understand what these are, the antigen is the virus. So here you can see the brain sample on a slide or any platform. You introduce an antibody with a conjugate, and you look for the antigen. With an antibody detection, you are looking for the body's response to the virus, meaning you're looking for antibodies in a person's blood or CSF. So here you lay out the sample, and then you add a conjugate with antibodies to bind to the antibodies in the system, and then you can detect the antibodies. So these two methods are used for detection. I'll come to that in detail a little bit. So everyone knows cell staining. We've been taught this very vigorously when we learned rabies in our undergrad. Cell staining is, I'm sorry to say, quite a useless test. It's used in many places because it is what we knew. We didn't know better, and this was one of the few tests that we had access to back in the day. It's a very simple test. It just uses two dyes, and the negri body, which is just, in simpler words, the cell walls of the virus. So this is in the brain, and the virus is multiplying. While it multiplies, it sheds its cell wall. Now the aggregation of these cell walls forms a negri body, and this picks up the stain. This is what we are seeing under a simple light microscope. Now one should understand that these negri bodies are formed most likely only in the hippocampus. And again, if you go looking, you don't find the hippocampus easily all the time. And even if you found the hippocampus, you might not find negri bodies, because negri bodies are not formed very well in all infections. And additionally, it's seen in cats better than in dogs, and in human beings it's not seen very much. So the sensitivity of negri body detection is very, very low. It's so low that you better not do it. It's just a waste of time. So if you know of anyone doing this, educate them to use better diagnostic tests. An interesting fact about negri body detection is I think his name was Henry Negri. His wife was actually the person who identified these bodies, and so the negri body is named after the scientist's wife and not him itself. So with fluorescent antibody, these glowing sparkly things are the virus. It has picked up the fluorescent conjugate that has been added to it, and we are looking at it through a UV microscope. What I want you to remember here is that the virus is in every part of the brain. It's flooded. If you take even a small bit of any part of the brain, it is seen like this. Unlike negri body, where you have to go looking for the hippocampus. Any part of the brain, pick it up, do a fluorescent antibody test, and you can see this if it is positive. Now, if you do have access to the whole brain and you want to know which is the best part to pick up, then the brain stem is the best part of the brain to pick up for fluorescent antibody test. Now, brain stem is just at the base of the brain, the end part of the brain just below the medulla oblongata, which becomes the spinal cord. That junction is called the brain stem. So why do we say brain stem is the best sample? Simply because while the virus is traveling up to the brain, the virus has to enter through the spinal cord and up here. And after it multiplies, it's going to go to the salivary gland. Remember, I said it has to go to the salivary gland because it needs to go to the new host. Now, when it's going to the salivary gland, it has to come back through the brainstem and then reaches our face. So the chances of picking up the virus to and fro is high if you pick up the brainstem. This is just a fun fact. If you have access to the brain, you're already sorted. Do not worry too much about the brainstem. Another test is direct rapid immunohistochemistry test. This is again a monoclonal body based test where a simple microscope, simple light microscope is used, and the red dots over here is the rabies virus, and the blue behind are the neural tissue. If you look at this image to the right, you can see a lovely neuron. This is one of my favorite images. You can see the dendrites that are it is studded with the virus. Beautiful picture. Unfortunate patient though. So these are all the tests that I spoke about are laboratory tests. We have very easily usable lateral flow tests now. These are very simple, just like the antigen COVID test or a pregnancy test. You put a sample, you wait for it. 2 lines is positive, 1 line is negative. Now these tests are not as sensitive as the gold standard. They are around 98 to 99% sensitive. So you cannot make a post-exposure prophylaxis decision based on this test. Meaning you might have person bitten by a dog, and now you have done a post-mortem on this dog, collected sample, got the test, and it comes out negative. Now you can't for 100% say that this dog is negative, don't take it. Anyone in an endemic rabies endemic country, irrespective of what the status of the dog is, please take post-exposure prophylaxis. It's easily available, and in most places affordable. In many states in India, it's free. So don't think too much. Oh, go get it. The vaccine is super safe. Pregnant people can take pregnant women can take vaccine. Lactating mothers can take the vaccine. Newborn babies can take the vaccine. Immunocompromised people can also take the vaccine. There is absolutely no problem in taking the vaccine. But if you don't take the vaccine, there's a chance that you might get rabies, and there is no treatment. So these tests, the lateral flow, which I'm showing on the screen right now, this test is it's a very good surveillance tool. So if you are working in a shelter or in a veterinary college, a hospital, this is a fantastic test to know if your patient was rabied or not. It is 99% sensitive and specific and sensitive, so it is a good test to put on record. Yes, the dog was rabied. It saves trouble transporting the sample to a laboratory. Maybe you could send only the negatives to find out if it was really negative. In the meantime, all the positives are positive. So it's an excellent tool. It doesn't cost, actually it does cost a bit. It's 350 rupees a test. Comes in a box of 10. So the whole box is around 3,500. Over the past 2 years, it has increased in price, and it's around 3,800 rupees a box. So another test is rapid, I've said rabies fluorescence. It's rapid focus fluorescence inhibition test. Here, this is using, CSF or serum of a patient, where you put the serum on a cell culture and put a known rabies virus, CVS, that is cultured in the lab. You put that and the serum on a cell culture, and you wait for it for 48 hours to grow. If the virus doesn't grow, that means to say there was enough antibody in the blood, in the serum, to prevent the growth of the rabies virus. So it's a very simple test, very nice. There are 2 laboratories that do it in India, NIMHANS in Bangalore and Veterinary College in Bangalore again. So there are, so another question I get asked is, can rabies be detected while the patient is alive? Yes, to a certain extent. The promising 100% result is given by brain tissue, by the gold standard test only, and brain tissue can be collected only after death. You cannot collect brain tissue while the animal or the human patient is alive. But there are ways with human patients that you can find out if the person is infected. So you can test saliva and do a PCR and look for the virus in the saliva. Or you can take the serum and check if there is an antibody titer. If the person is vaccinated, then the titer is at a moderate level. If the person is infected, the antibody titer is very high. and in the CSF. In the CSF, you can find the antigen in an infected person, and also you can find antibodies in the CSF in an infected person. Now, one may ask, why can't we do this in dogs also? You can, but nobody has ever tried it. But people have tried other things with dogs. We have used skin, we have used salivary gland, we have used CSF, urine, hair follicle in rabid dogs, and we have found that they are not very sensitive, but an surveillance tool or a diagnostic tool to some extent. So clinical presentation, rabies is a very mysterious disease, like I said before. There is a furous form and a paralytic form, and the animal does not decide to sit in this box. It can be paralytic in the morning, it can be furous in the evening, and become paralytic again in the morning. So it depends upon at what time you see the patient. Paralytic form is we all know that the aggressive form, the furious form, is more dangerous because the animal will bite, will chase and bite. But the paralytic form is deceptive. So there have been a lot of cases where puppies with the paralytic form look cute and are not eating, and people pick up these puppies and try to feed them or give medicines. They have given antibiotics also with their bare hands. They put their hand in the puppy's mouth and get exposed to rabies. So any unknown animal, especially cats and dogs, if you do not know if they're vaccinated or not, please use gloves. And for rescuers and animal lovers, if you are passionate about this, please vaccinate yourself, period. That's all, very simple. So you will, even if by chance you do touch an animal without gloves, or if you get a spray of saliva on your face, you are protected for life. The rabies vaccine protects you for life, meaning if you take a 3-dose pre-exposure, you are protected for life. The only problem is that you'll have to take 1 or 2 doses after being exposed again. But the antibody protection does last for at least 10 years, but this is academic information. In real life, we cannot give this advice. We need to advise people to get a post-exposure for sure after getting an exposure, even if they have been taken pre-exposure prophylaxis. These are some of the clinical signs. Like I said, sometimes I've just seen one on this list, sometimes I've seen 2, and we've had to make a decision of rabies or not. These are clinical signs in other animals. The previous slide was on dogs. I am also very aware of the time, so I'm going to go through the presentation a little more quickly. One thing I want people to remember is hydrophobia is not seen in animals. Hydrophobia is only seen in humans and not in all humans. Some people, like around 70% of people, show hydrophobia once they're infected with rabies. Aerophobia is a fear of wind, and photophobia is a fear of light. So these are also other signs that are seen in animals and people. Please do not keep a bowl of water in front of a rabid suspected animal and watch if it will eat or drink. I have seen rabid animals eat and drink till the last minute. So they ate and turned around and died like that. Another advice is, the WS logo is blocking the presentation. So I've, during my PhD, I saw what clinical signs were the most popular clinical signs in rabies, and found that salivation, hypersalivation, was seen only in 21% of the rabid animals. So you cannot use hypersalivation as a pakka clinical sign for diagnosing rabies. So at this point, I would like to also share a video that we have made on rabies clinical signs. Sharing it in the chat box. Please have a look when you have time. So moving on, this puppy here had come for surgery. This was a shelter. I worked in Bangalore. Very friendly puppy. We all loved her. She had come for amputation. When the puppy came in, so all dogs that come in get vaccinated immediately for rabies. She was there with us for 3 days. We brought her up to health got her ready for surgery, amputated her foot. She was recovering from it. Here I am doing post-surgical dressing on day 2, and she started later that next day. the staff told us that she bit around 17 dogs in the shelter. She started behaving very weirdly, suddenly was not responsive to any of our calls, and rabies did not strike us then because for some reason we thought, yeah, she's vaccinated, right? So later we gave her a lot of treatment. We thought it was some kind of encephalitis, and we treated her with antibiotics that could pass through her blood-brain barrier, and we watched her die slowly. It was very unfortunate. I wish I had put her down. It is awful to see a dog die of rabies. And we got it tested from Bangalore Veterinary College, and it came back positive for rabies. Months later, I was looking at photos, and I found this photo, and I was like, oh yeah, this was that rabies puppy. If you look closely, you can see a bite wound on her thigh. So this puppy was hit by a vehicle, and she was incubating the rabies virus. This has happened many times with us. A lot of dogs have come for ABC, and after surgery, the stress of surgery speedens the movement of the virus into the brain and shows clinical signs. So another tidbit before I forget: if a dog is vaccinated before for rabies and you give it a post-exposure or a booster, the chances of survival is very high. Meaning a dog is vaccinated before, gets exposed at some time, and now the dog is in front of you as you are a veterinary doctor. If you give a booster, the dog will survive. Similarly, like human beings, where naive people who have never taken pre-exposure get exposed to a rabid animal, take post-exposure prophylaxis and survive. Similarly, it is possible in dogs, but studies have shown that there's a 25% chance that it will not, because we are dealing with a virus that has evolved and acclimatized itself to canines. So it establishes very quickly, it transfers from the site of bite to the brain very quickly, and the disease is seen. But post-exposure can protect dogs from rabies. So my advice to veterinarians is, if you are in a situation where you have a dog that has been bitten by a dog, please give post-exposure, but you'll have to put it under strict observation. I'll come to that management in a little bit. I'm sorry, I digressed. So yeah, it was just a slide away. So if you're dealing with a dog that is showing clinical signs of rabies, it is very easy. I mean, the decision is easier. It's not an easy situation. So the problem is, you might look like canine distemper, it might look like poisoning, it might look like spinal injury. As a veterinarian, even till today, even after seeing 300 rabies cases, I still am in dilemma many times. So the best way is to put it in observation. Now, when you put the dog in observation, please give it food, water, and warmth. Leaving it starved will cause death anyway, so that is not isolation. Please isolate properly. If the dog starts deteriorating in health and starts showing more number of clinical signs of rabies, the best the decision is to euthanize. Because with knowing that it is rabies, putting staff who are looking after a suspected rabid animal, you're putting the staff under danger. You're also risking the exposure of other animals to this dog. The dog might escape, and also, most importantly, the dog is suffering. There is no way of interviewing a person who has rabies and say, are you suffering, is it painful, like you could with other diseases. If you look at a rabid animal, you can see that it is suffering, and euthanasia is recommended. Now, euthanasia recommendation is a very sensitive topic. So as a veterinarian, what I do and what my other colleagues do is, we have other veterinarian friends who we discuss this and take a joint decision. So the error of decision is reduced when you have more than one person making this decision. Now, if the animal is under treatment, suppose it looks like poisoning, you're giving it fluid therapy and it starts improving, yay, it's not rabies, you wait for it for 10 to 14 days, and then you can consider it normal. And at this point, please vaccinate before releasing the animal. Now, the other tricky situation is that you have a dog in front of you and it has been bitten by another dog. Now, we do not know this other dog. Let's assume it's a free roaming dog, a stray dog, and you're a veterinary doctor. In your clinic, there is a dog in front of you that has been bitten by a unknown dog. Now, the first question is to ask if the dog is vaccinated. Many people forget to vaccinate their dogs annually. It is very surprising how many weddings and birthday parties and whatnot come in the way of vaccinating dogs. People will say, yeah, maybe 2 years ago I did it. 3 years ago we got the dog vaccinated. Your next question would be, please show me your dog's vaccination card. Like we all know, most people lose vaccination cards. So now you are dealing with a very tricky situation. You will have to make very important decisions at this point. Now, in developed countries where canine rabies is not endemic, not vaccinated and exposed to rabid animal or on an animal is considered, the euthanasia is a recommendation, but we do not have this recommendation in India. We do not have a national recommendation for case management of this sort. So it entirely the decision relies on the practicing veterinarian right there. So as a veterinarian, what can you do? You can treat the wound just like you would do in a human being. I'll come to first aid in a bit. You do regular wound treatment. Then you can also use immunoglobulin, but do not use it in a situation where you'll have to make an ethical decision. Are you going to steal human biologicals that are meant for humans, or are you going to use it on a dog? Immunoglobulins work, you can give it to a dog. And then rabies vaccination. You can give a rabies vaccine and give the dog a chance to survive. You will have there is no recommendation again. There is no international or national recommendation for treating a post-exposure. There's no recommendation of post-exposure prophylaxis in dogs. So what you could do is give an annual booster or use the human regimen of 0, 3, 7, 14, 28. And most importantly is to isolate the dog and make sure the owner understands that the rabies can occur in the next, how many months? 6 months. So the animal that you have now vaccinated and sent back home has to be under observation for 6 months. Now it's tricky, right? People sleep with their dogs on their bed, keep them on their sofa, they let them lick their face. You will also have to make this decision and make the owner understand how dangerous this is and that they actually might be dealing with a ticking bomb. I am running out of time, so I will go ahead. Have I left out anything with regards to... I might come back. If any questions, please feel free to chat in the comments. So I was thinking of showing a few rabies videos, but maybe I will have to go through. I'll go through them quickly. This is a paralytic form of rabies. Brownie is not responding, can't respond. There's lockjaw, hypersalivation, bent neck. Yeah? So this dog suffered like this for many days, unfortunately. This is another video from my PhD. This dog belonged to a family with 7 other dogs. They had taken care of their dogs very well. They would leave their dogs free in the compound, but I think I can't remember their vaccination status. But this dog looked like this, very sad. It was. It's choking. One would think that there is a bone or there is something stuck in the esophagus or in the trachea. Lot of veterinarians have put their hands into rabies suspected animals, cows, goats, dogs, to remove the choke. in this case, the dog died half an hour after this. I wish I had euthanized this dog, but yes, very sad, very unfortunate. This is a puppy that was very confusing. Change of voice is a very clear clinical sign, but you need to know this change. It comes with experience. It looks really cute, playful puppy. Oh, look at it, so cute. But yes, was rabied. I thought I'll show a few videos of other animals. This is a rabid heifer, very angry, very irritated. You can see hypersalivation. Cows are generally calm beings. She was very annoyed with us. And oh, this is a very small calf. It was a 4 or 5 month old calf, and you'll see how angry the calf is pothing. Yeah, pothing. Yes, I would have shown you more, but time is a constraint. So coming to vaccination, vaccines were invented, not discovered, invented back in 1796. The first vaccine that humans made was the smallpox vaccine. All of you would remember Edward Jenner, smallpox. He used cow scab tissue from cow poxes and introduced it into human beings, making a cut and introducing the scab tissue, and those people did not get smallpox. And this is an accidental discovery, like most of the best discoveries we've had on the planet were accidental. Here he found that milking women who milked cows did not get smallpox because they were exposed to cowpox. So 100 years after the first vaccine that after the first vaccine that was invented, rabies vaccines were invented. So Louis Pasteur in 1885, in 1870 he started playing with the virus, was inoculating it into different animals and seeing how the animals behave and what they could do. Along with him was Camille Roux and another scientist, I can't remember. There were 3 of them who worked together and made these amazing discoveries. So and this is again 120 years ago. So vaccines have been around for 200 years now, and rabies vaccine is one of the oldest vaccines on the planet. And of course, smallpox doesn't exist anymore. We have successfully eradicated it from the planet. So there are 4 types of vaccines: live attenuated, inactivated or killed, and toxoid and subunit or conjugate vaccines. The vaccine that we deal with for rabies is an inactivated or killed vaccine. Okay. So the vaccine development, like I said, so the rabies vaccine development started in 1870, and in 1885, Pasteur came up with the first rabies vaccine. So on the 6th of July in 1885, this was oh, I forgot the boy's name. So this boy here was bitten by a rabid dog or a wolf, I can't remember, in France, and his parents were willing to let Louis Pasteur and his team to try this rabies vaccine that they were talking about. Now this nerve tissue based vaccine was very crude. It was made from rabbits. So what Pasteur and his colleagues had done was they would infect a rabbit, let the rabbit get full-blown rabies, then euthanize it, take the nerve tissue, the spinal cord of the rabbit, dry it, desiccate it, powder it, put it with normal saline, and then give that as a vaccine to the animal or human being. Now this is very crude, there were a lot of side effects, but it worked. Over the years, have I made a slide for? Yes. So over the years, there were other nerve tissue vaccines. I'll go back to the timeline. Later we had sheep brain vaccines, where the same thing what I described in rabbits was done with sheep brain. And then slowly, as tissue culture started, the virus was grown on tissue culture, and the tissues that were used were slowly moved from other animals to primate tissue culture, and today we have human diploid cells that we make vaccines from. So the side effects have reduced drastically, because the material that the virus is grown on is very close to human tissue, and the immunogenicity of the virus has been modified and improved very well. So the vaccines have become safer and better. So few of us, older lot, would remember stories of people having to take 14 vaccines around the navel. So this is our sample vaccine, developed in Himachal Pradesh near Shimla, and this was used across the globe. People sorry, what I wanted to say here was that this photo here is of people traveling to France from across the globe to get the rabies vaccine, and here is a picture of 2 boys who received the vaccine in Singapore. Sorry, I'm a little distracted. I lost my flow of thought. So sample vaccine was used for many years, a lot of side effects. We needed 14 vaccines around the navel. And you might ask, why around the navel? That's because you needed to give around 3 ml to 5 ml of the vaccine. Now, where can you put that much vaccine, right? You can't put it in your arm. It's going to bulge and hurt. So the only place that you could introduce that much volume of vaccine was in the abdominal area, into the peritoneum. So this that is why we needed it there. And because the vaccine was not that advanced, we needed a lot of the vaccine, a lot of amount of the vaccine. So you needed 14 vaccines around the navel. Now, these vaccines have been banned in most part of the world, and only tissue culture vaccines are being allowed to use. So this is sample vaccine. Some countries do still use it. In a country in Africa, I can't remember which one, and another country I can't remember. But yes, slowly WHO highly recommends not to use nerve tissue vaccine, and to use only tissue culture vaccines. So vaccination schedule in puppies. There are other diseases which you need to prevent puppies and dogs from getting, but the public health issue is rabies, and my talk is on rabies, so I'll focus on that. Rabies vaccine needs to be given at the age of 3 months. Now the label says 3 months because the pharmaceutical can promise an immune response in a puppy after the age of 3 months. If a puppy is given rabies vaccine less than the age of 3 months, it might not show an immune response, but it will not cause any harm. So in a mass vaccination scenario where we are vaccinated stray dogs, we vaccinate even day-old puppies to give that puppy a chance of getting protected from rabies. It might not get protected, it might get protected, but it will not harm the puppy, because the mother is not vaccinated, so the puppy will not have any antibodies to protect it from rabies. Okay. I had included this slide about dogs moving across borders. A lot of countries have different rules and regulations about when the dose of vaccine should be given to a dog before it enters a country, and also if antibody titer test is required. Recently, United States banned importing of dogs from 80 countries because unfortunately they have dogs that are vaccinated still carried rabies with them because of bad quality vaccines. So coming to post-exposure and pre-exposure prophylaxis, everyone who touches animal and animal product should take rabies vaccine. It could be veterinarians, veterinary technicians, veterinary nurses, pet groomers, butchers, farm animal workers. All these people come under high risk category, and it's an occupational hazard to come across rabies, and also people working with wildlife. So and animal rescuers and animal lovers, please just go take your pre-exposure vaccines. Now, WHO categorizes exposure into three: category 1, category 2, and category 3. Category 1 is a lick on intact skin. There's no opening on your hands or feet, and a dog licks you. That's not an exposure. But if a dog licks on broken skin, there's a cut, your dog licks you, that is an exposure. And any kind of bite or scratch where there is a cut in the skin is a exposure, where you need both immunoglobulin and vaccine. Okay. So there are various schedules. India recommends 037 14 28 intramuscular. But we have now better vaccines, so the last dose has been removed. You can just take 037 and the 14 has been moved to 28. And there is also intradermal method where you have just 037 and you take 2 shots on either side of your arm, on each arm, and it's just a small quantity, 0.1 ml, like a mosquito bite. Very easy, works extremely well. Remember, do not let anyone take their rabies shot on their glute, on their buttocks. A lot of children, especially if they're not cooperating, nurses and doctors tend to vaccinate the buttock of a child because it's just easier to hold. Crying child, you hold them like this and you inject from the back. A lot of people with low muscle mass are very thin, so they can't take their vaccine on their arm. Even they other vaccines can be given on their buttock, but please do not give rabies vaccine do not take or give on a person's buttock, because there is adipose tissue there is fat. Now the vaccine is racing with the virus. The virus has entered the skin. It is now aiming to go to the brain, and you need the vaccine to enter the blood and seroconvert and give the person protection by producing antibodies. Now if you're going to put the vaccine in adipose tissue into fat, it's just going to sequester, just stay there and not produce a response in the person. So remember, it's a race between the vaccine and between the virus, so it has to reach the system as soon as possible. So simple, rabies vaccine has to be given in the arm, that's all, period. I said I'll come back to the first aid part of rabies suspected bites or dog bites. Please remember to wash wound with soap. Any soap. I like asking people, what soap would you like? And people say Lifebuoy, or they say a soap with ascorbic acid. This is not true. Ascorbic acid is used only when you have to kill the spores of anthrax, and that's a bacteria with a spore. Viruses are very fragile. They do not need ascorbic acid. They just need soap. Any virus dies with soap. So the lather behaves as a surfactant and breaks the cell wall of the virus, and it dies immediately. It's very easy. Close to 99% of the virus load is reduced by washing the wound with running water and soap. Lather nicely for 15 to 20 minutes. This is the first thing anyone should do in case of a person bitten by a dog or a dog bitten by a dog. Okay, so just do the same thing what you would do with dog patients that you would do with a human patient. Now, after washing the wound with soap, you can use betadine, povidone iodine, no brand name as such. Povidone iodine is a very good antiviral it's a very good virucidal. Do not use Dettol. It don't help. Dettol does not have surfactant in it. It is not going to kill the virus, while Savlon does lather, so there is a chance of the virus dying. So just remember, use soap. Very easy. Tell people to use soap. Now after this, now you have used any a virucidal, you go and take a vaccine. Now if you've been vaccinated before, you don't need to take immunoglobulin, but if you are never been vaccinated before, you need to take immunoglobulin around the bite. Okay, remember, a lot of people land up taking immunoglobulin in the arm also. Now the immunoglobulin is an antibody, ready-made antibody, because remember I said that the body takes 2 weeks to convert a vaccine into antibody in your blood. What scientists and researchers and the pharmaceutical industry has done is they have made ready-made antibodies that you can put at the site of bite, in the wound. So if there is a bite here, you inject the immunoglobulin around the wound. this neutralizes the virus immediately. So now you've killed as much as possible of the virus by soap, and you've neutralized rest of the virus by antibodies, that is rabies immunoglobulin, RIG, and you also have taken the vaccine to protect you from that bite and future bites. Lot of people want to put haldi, chili powder, cumin powder, and whatnot, pura kitchen ka stuff they want to put. Let them put. It might cause other infections, but please wash your wound first and then you put anything you want. Because I've found a lot of resistance when I ask someone not to do something. It is just easier to tell people, please do this first and then you do whatever you want. Like a lot of people want to take Ayurvedic and homeopathic medicine. These do not protect you against rabies. If you still want to take, please take, but please take vaccine before you do any of this. Take your 5 shots and you take those homeopathy tablets. Doesn't matter what you're taking after you've taken your vaccine. So the best thing to do is first is not get bitten. So as a veterinary doctor or a rescuer, anyone working with animals, try not to get bitten. There are many ways not to get bitten. Learn dog behavior, learn calming signs, signals that a dog is trying to tell you. Many times a dog is licking its lips, looking down, ears are down, wailing of eyes. These are calming signals. The dog is trying to tell itself, don't get angry, don't bite, that person is going to do anything to you. But we do not read those signs and we do something extra. So as a veterinarian, you will have to handle dogs and inject them, etc. So read these signs, learn how to manage dogs and cats better, and try to get exposed less. Thank you very much. And yes, I am from Mission Rabies, and this is one of my favorite slides. And I am ready to take questions, unless I've lost the 3-member audience I had. So Vasanta, I don't think anyone's there. So what we'll do?
We had 10 to 15 viewers like throughout
lovely.
your talk. Yeah.
Okay.
I don't think we've got any comments.
Okay.
There's one from
or maybe
Mark
it takes
Hodgkin
a little bit
UK.
of time from YouTube or Facebook to enter this platform.
No. It comes straight away.
Oh, okay.
Yeah.
Okay. I also wanted to speak about editing the video before you put it up.
Yes, I'll do that.
Oh, okay.
Yeah.
Let's wait for a few minutes just in case anyone has any questions, and
Sure.
then we'll wrap up. Also, Vasundhara, I was thinking,
Yeah.
the flow in the beginning of the presentation isn't very good. What we can do is, I don't know if you want to do it today or some other day. We could just, I could go through the first few slides once again,
Sure. We can do that. Yeah.
and then you can put them together. No? You can edit it and put it together.
Yeah.
Okay. Would you know 15 people, who these 15 people were?
So after the broadcast ends, I can check the insights.
Okay.
Yeah. Yeah, we've received 2 comments.
Mm-hmm.
Oh, we've received, yeah, 3 comments. One is from Mark Hodgson. I have flashed it on the screen.
Mm-hmm. Thank you, Mark. Thanks for listening in.
We have Lisa.
Thank you, Lisa.
Yeah. Yeah.
Would you mind, so this is from Anil Yadav, would you mind
Yes.
explaining the post-exposure in dog and cat in detail, like time of post-exposure? It was great hearing about rabies in veterinary. Thank you very much. Thank you, Anil. So you're asking me if what the post-exposure prophylaxis in dogs and cats are. There is no recommendation, unfortunately. So the only option we are left with is to use the human vaccination schedule. Um, so if a dog or a cat has been recently vaccinated in the past 3 years or 1 year, depending on the brand of the vaccine, some vaccines promise 3 years of immunity, some vaccines promise only 1 year of immunity. So within that immunity period, if an animal is exposed, then just one dose will protect the animal. Now, if you don't know the vaccination status of the animal, then the suggestion is to go with the human schedule. And again, like I stressed, isolation and observation is very important, because it's a ticking bomb. You don't know when that animal can turn rabid, in spite of post-exposure prophylaxis. And since you work in WVS, we can talk sometime. Um, Contact Vasundhara, she'll give you my number. Also, Vasundhara, my number is only for our staff, not to anyone else.
Yeah, I'll keep that in mind.
Yes.
Wait for a
This is the quietest webinar I've ever had. Welcome. Talk soon, maybe, Anil. Okay. Shall we wrap it up then?
Yeah. Thank you so much, Dr. Gowri, for enlightening all of us
Welcome.
about
Pleasure.
rabies and how to prevent this deadly virus. Thank you. Thank you so much.
Welcome. Bye bye.
Bye bye.